Complement 3 glomerulopathy, also known as C3G, is a rare kidney disease that can affect people of any age, but is more commonly seen in children and young adults. This disease has a significant impact on a person's overall health and quality of life. C3G has two different forms, dense deposit disease, DDD, and C3 glomerulonephritis, C3GN. Both forms can be caused by genetic issues, which may or may not be inherited, or by health complications that occur during a person's life. In both forms, there are problems with the complement system, which is responsible for fighting infections in the body. The tiny filters in your kidneys, known as glomeruli, play a crucial role in cleaning your blood and maintaining your overall health. However, in the case of DDD and C3GN, these glomeruli become damaged, allowing proteins, red blood cells, and white blood cells to leak into your urine. This disruption in kidney function can eventually lead to kidney failure. Research suggests that DDD may have a greater impact on younger individuals compared to C3GN. Proteinuria is when there's too much protein in your urine, which can make it look cloudy, foamy, or dark. Hematuria occurs when damaged glomeruli spill red blood cells into your urine, making it appear red, pink, or brown. Gout can be painful when uric acid builds up in your joints due to kidney issues. Edema causes swelling in your feet, hands, and ankles, or around your eyes due to fluid buildup from kidney problems. Oliguria happens when you don't pee enough, and high blood pressure can result from fluid buildup due to kidney issues. Fatigue, infections, and kidney failure are also common symptoms of complement 3 glomerulopathy. Other symptoms of kidney failure include nausea, vomiting, lack of appetite, trouble sleeping, dry and itchy skin, a metallic taste in your mouth, and muscle cramps. Additionally, acquired partial lipodystrophy and eye problems can also occur with C3G. To diagnose C3G, your doctor will perform a kidney biopsy. This involves removing a small piece of your kidney to examine in a lab. They may also conduct genetic testing, as well as blood and urine tests. These are the only ways to accurately diagnose C3G. So if you've been diagnosed with complement 3 glomerulopathy, you might have some questions for your doctor. Here are some things you might want to ask. How did I develop C3G? Which type of C3G do I have? What are the best ways I can control my health with this condition? What are my treatment options? What can I expect in the future with this disease? Treatment for C3G can vary, as there is no single best option. However, there are some treatments that may help improve your symptoms and slow down the progression of the disease. For example, controlling your blood pressure and proteinuria can be beneficial. This can be achieved with the use of medications such as ACE inhibitors and ARBs. Additionally, managing high cholesterol with medication may also help slow down the progression of C3G. Another option is a combination of glucocorticoids and mycophenolate mofetil, which are medications that can suppress your immune system and prevent relapses in some individuals. Furthermore, the use of the anti-complement drug eculizumab, Soliris, has shown promise in lowering proteinuria and slowing down the progression of C3G. New therapies, such as iptacopan, LNP023, are also being studied for the treatment of C3G. The FDA has designated this drug as a breakthrough therapy and rare pediatric disease, which means research into its effectiveness for C3G will be expedited. It is important to take care of yourself if you have C3G. Here are some things you can do to help manage your condition. Eat a healthy diet, make sure to include plenty of fruits, vegetables, whole grains, and lean protein in your meals. Limit saturated fats, salts, and sugars. Your doctor may also recommend that you limit your intake of potassium, sodium, or phosphate to help manage your condition. Stay on top of your health. It's important to stick to your treatment plan and take all your medications as prescribed. Be sure to tell your doctor about any concerns or unusual symptoms, and let them know about any other medications or supplements you are taking. Exercise. Regular physical activity can help improve your overall health and well-being, including better sleep, more energy, and stronger bones. It can also help reduce the risk of heart disease and other complications. If you are on dialysis, talk to your doctor about the best exercise plan for you. Stop smoking. quitting smoking can improve your overall health. Ask your doctor for help if you need it. Limit alcohol. Check with your doctor to see if it's okay to drink alcohol in moderation, and ask for help if you need to cut back or stop. After being diagnosed with C3G, your healthcare team will work with you to determine the most effective treatment plan. In some cases, you may have the opportunity to participate in a clinical trial, although these can be difficult to access due to the rarity of the disease. In more severe situations, you may ultimately require dialysis or a kidney transplant. However, there is a significant risk of C3G recurring even after a transplant. It is important to have a discussion with your doctor to explore the most suitable options for your individual circumstances. As the disease progresses, your symptoms may worsen. Approximately 50% of individuals with C3G will eventually develop end-stage renal disease, ESRD, usually within 10 years of diagnosis. ESRD is a life-threatening condition that indicates the kidneys are no longer able to effectively filter fluids and waste from the body. If you or a loved one is living with C3G, it's important to find support and resources. You can turn to the National Organization for Rare Disorders, NORD, or Disease Info search for more information. Additionally, there is an online support community provided by the National Kidney Foundation for those living with C3G. It's also a good idea to talk to your doctor about genetic testing to learn more about your possible risk for C3G. In dealing with C3G, it's important to have a team of healthcare professionals on your side. This team may include your primary doctor, a nephrologist who specializes in kidney problems, a hematologist who works with blood diseases, a transfusion medicine team to test your blood, a pathologist who examines tissue samples, and a laboratory medicine team. These experts will work together to provide the best care and treatment for your condition.